Hello, everyone. I'm thrilled to be here to share with you about Levels. My name is Dr. Casey Means, and I'm the co-founder and chief medical officer of the company. Levels is involved in the CGM space, and I so appreciate the opportunity to be speaking to a community here who is intimately involved with this technology. Thank you very much for taking the time to learn about Levels. Levels is a software overlay to contextualize and interpret the CGM data stream in order to facilitate personalized diet and lifestyle and increase metabolic awareness. We also facilitate community, whereby people can share and connect around their metabolic data and learn from each other. Currently, our app is a wellness product, meaning that it's meant for understanding how diet and lifestyle choices are impacting glucose levels, but is not meant to be used as a software tool to diagnose or treat any specific condition. Our program is oriented around a 1-month experience that involves 5 things. First, we connect customers with an independent telehealth network of board-certified physicians in their state who evaluate the individual for a CGM prescription. A partner pharmacy ships a month's worth of CGM sensors to the customer, and they are set up with the Levels app. The Levels app provides structured analysis of the CGM data stream, helping break down what is causing spikes, opportunities to optimize choices to improve glucose levels, integrating sleep and activity data into the glucose data stream, and deep educational content. We also provide end-of-month reports, compiling learnings and insights from the month of use. The end result is that people using Levels for a month have a better understanding of how their dietary and lifestyle choices are affecting their glucose levels. Our mission at Levels is to solve the metabolic health crisis through personal empowerment with continuous biofeedback and to increase accessibility of metabolic monitoring for all. One of the key features of metabolic awareness in the app is our Levels Zone Score. Zone scores provide a simple composite metric from 1 to 10 to understand the impact of a meal and how other factors like exercise, sleep, or stress impacted it. And this information is paired with educational content to further expand understanding and give suggestions on swaps, alternatives, and tips that could help promote more stable glucose levels. Also important to metabolic awareness are features including comparisons and challenges. Comparisons and challenges help members understand how different versions of food and lifestyle choices can have different effects, as well as the impact of sleep, stress, and movement on glucose responses. Here on the left, you can see a member who tried 3 different types of granola bars and found that they all had drastically different glucose responses, despite all being marketed as health bars. In terms of challenges, a challenge might be to eat a meal on one day and eat an identical meal with a walk the next day and see how the glucose responses differ. We facilitate engagement with the data stream by creating effortless logging with the camera on the smartphone and easy voice dictation or typing logs of meals, as well as features like automatic event detection, which alerts someone to changes in their glucose so they can zero in on what choices may have led to this. We also draw attention to how food is rarely the single variable in a glucose response. In order to help highlight the holistic relationship between lifestyle activities and glucose control, we have integrations including sleep data and activity data. We focus on highlighting progress in an effort to make our product as supportive and encouraging as possible. The glucose feedback is not meant to be a judgment on health, but rather an educational opportunity to learn. And we design the app and the features in the app around showing people their progress and their wins. And this includes our day score, the way that we track glucose metrics over time, our meal catalog, and our reports. We've had about 10,000 people go through our beta program, and member feedback has been vocal and positive. People know that they feel better, that they're able to lose weight, and they feel empowered about their health after using it in a way they never have before. We also see people note an increase in empathy. One member stated, quote, "I've been feeling an emotional awakening of empathy for my mother's experience with diabetes and the decades I couldn't quite grok her life." We're also seeing a highly engaged community emerging on social media who are eager to help each other learn how to be metabolically healthy and keep glucose more stable. And we have product features in our pipeline that will help people learn from population data and shared data within the app so that people can, for the first time ever, choose meals, ingredients, and recipes based on objective data rather than health claims. In order to achieve our mission, we need to improve the state of the science around the outcomes of CGM use and improve accessibility of both the hardware and the software. We're approaching this by investing in metabolic health research, working with academic partners at Yale, Thomas Jefferson University, Brigham Young University, and the University of South Florida. Second, we're creating software that breaks down the complexity of glucose control, which we aim to make widely accessible. And third, we're bringing attention and investment to the metabolic monitoring space for both hardware and software with the intention of catalyzing innovation in the space. Currently, we're in a closed beta program, refining our product, and there are about 120,000 people on our wait list. We're aiming for a full launch in the third quarter of 2021. Thank you so much.